Geneva, about 25 million children worldwide have missed out on routine immunizations against common diseases like diphtheria, largely because the coronavirus pandemic disrupted regular health services or triggered misinformation about vaccines, according to the UN in a new report published Friday. Data showed the vast majority of the children who failed to get immunized were living in developing countries, namely Ethiopia, India, Indonesia, Nigeria and the Philippines. While vaccine coverage fell in every world region, the worst effects were seen in East Asia and the Pacific. Experts said this historic backsliding in vaccination coverage was especially disturbing since it was occurring as rates of severe malnutrition were rising. Malnourished children typically have weaker immune systems and infections like measles can often prove fatal to them. The convergence of a hunger crisis with a growing immunization gap threatens to create the conditions for a child survival crisis, the UN said. Scientists said low vaccine coverage rates had already resulted in preventable outbreaks of diseases like measles and polio. In March 2020, WHO and partners asked countries to suspend their polio eradication efforts amid the accelerating COVID-19 pandemic. There have since been dozens of polio epidemics in more than 30 countries. This is particularly tragic as tremendous progress was made in the 2 decades before the COVID pandemic to improve childhood vaccination rates globally, said Helen Bedford, a professor of children's health at University C. She said the news was shocking but not surprising, noting that immunization services are frequently an early casualty of major social or economic disasters. The effects of what happens in one part of the world can ripple out to affect the whole globe, he said in a statement, noting the rapid spread. Whether we act on the basis of ethics or enlightened self-interest, we must put children top of our list of priorities,